Thyroid disease and diabetes. Diabetes mellitus is closely linked to thyroid dysfunction. Many studies showed the prevalence of thyroid disorders in patients with diabetes mellitus and vice versa. Thyroid is a butterfly shaped gland at the front of the neck. It produces hormones such as T3 triiodothyronine and T4 thyroxine, which helps to regulate body processes such as metabolism, mood, breathing, and heart rate. When thyroid produces excess hormones, it is called hyperthyroidism. When it underproduces hormones, it is called hypothyroidism. Autoimmune conditions can result in development of certain thyroid disorders like Hashimoto's thyroiditis and Graves' disease. To explain the mechanisms linking overt and subclinical hypothyroidism to type 2 diabetes mellitus, we must understand the central and peripheral control of thyroid hormone on food intake and glucose and lipid metabolism in liver, pancreatic beta cells, skeletal muscle, and adipose tissue. Excess thyroid hormone increases lipolysis and secretion of both insulin and glucagon, and these effects disturbs glucose metabolism, which can cause glucose intolerance and diabetes. We must also look into the link between genetic and pathogenetic mechanisms involved in autoimmune type 1 diabetes and autoimmune thyroid disorders. An untreated thyroid dysfunction can impair the metabolic control in diabetic patients. It suggests that there is a link between insulin resistance and both hyper and hypothyroidism. Because thyroid hormones are essential for carbohydrate metabolism, thyroid dysfunction can impact insulin and lead to development of type 2 diabetes mellitus. Hypothyroidism and diabetes usually go hand in hand. A diabetic patient will invariably become hypothyroid because their cells become blocked from using thyroid hormone efficiently. And a patient who is hypothyroid will have a tendency towards becoming pre-diabetic and eventually diabetic. Then the question often asked here is it mandatory to routinely check your thyroid levels if you are diabetic? The answer to this is yes. It is always advisable to check your thyroid levels at least once a year if you are diabetic, because hypothyroidism may not cause noticeable symptoms in its early stages, but over a period of time, if it is not diagnosed and treated, can lead to other health problems such as hyperlipidemia and heart diseases. Now, what are the most commonest symptoms in hypothyroidism? Symptoms of hypothyroidism usually develop slowly once your metabolism becomes slower. It includes dry skin, weight gain, hoarse voice, more sensitivity to cold, extreme tiredness, constipation, thinning of hair, muscle weakness, bradycardia, depression, and memory problems. What are the causes for hypothyroidism? The most commonest causes for hypothyroidism include an autoimmune disease called Hashimoto's disease. Here, the immune system makes antibodies that attack and destroy healthy tissues. Patients post-thyroid surgery may develop hypothyroidism. Thyroiditis, or an inflammation of the thyroid gland, can trigger the thyroid to release all its stored thyroid hormone, resulting in hyperthyroidism. Exposure of neck to radiations during cancer therapy is another cause. Certain drugs like lithium can also cause hypothyroidism. It can also develop in pituitary disorder, problems at childbirth due to deficiency of iodine, etc. Women are at more risk of developing hypothyroidism. Others at risk include those with an autoimmune disease like type 1 diabetes or celiac disease, those with a family history of thyroid disease, those who have had thyroid surgery in the past or who had exposure to radiation to neck. The commonest complications noticed in patients with hypothyroidism include goiter, heart problems, infertility, birth defects in children, and peripheral neuropathy. So, during your routine evaluation, if you happen to notice an abnormal thyroid function test, it should be further investigated and also treated if necessary. To summarize this topic, I would say that it is quite common to have diabetes and thyroid disease together in a patient. In fact, if you have type 1 diabetes, type 2 diabetes mellitus, insulin resistance, or metabolic syndrome, your chances of developing thyroid disease is increased. Diabetes caused by thyroid disease can also contribute to metabolic syndrome, which is a cluster of high blood sugars, hypertension, high triglyceride level, low HDL cholesterol level, and a large waistline or obesity. This in turn increases the risk of heart disease, diabetes, and stroke.